This tablet is a combination of vitamins used to address vitamin deficiencies caused by a poor diet, certain illnesses, or during pregnancy. Vitamins are essential for the body and play a crucial role in maintaining good health. When taking the ABC Complete Senior Men's 300 Mcg-60 Mcg-600 Mcg-300 mcg tablet, it is important to follow the instructions provided by your doctor or on the product package. It is typically taken by mouth once daily. It is important not to exceed the recommended dosage. Taking this medication regularly at the same time each day will help you get the most benefit from it. If you have any concerns or questions, be sure to consult with your doctor or pharmacist. If you experience constipation, diarrhea, or upset stomach while taking this medication, know that these effects are usually temporary and may go away as your body gets used to it. If these effects persist or worsen, make sure to inform your doctor or pharmacist right away. Remember that if your doctor has prescribed this medication for you, it means that they have determined that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. Although it is rare, a very serious allergic reaction to this medication may occur. Seek immediate medical attention if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or difficulty breathing. This is not an exhaustive list of possible side effects. If you notice any other effects that are not mentioned, make sure to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about any side effects, or report them to the FDA. In Canada, you can also call your doctor for medical advice or report any side effects to Health Canada. It's important to keep products containing iron, like ABC Complete Senior Men's 300 Mcg-60 Mcg-600 Mcg-300 mcg tablet, out of reach of children, as accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. If overdose does occur, it's important to seek medical help immediately or call a poison control center. Before taking ABC Complete Senior Men's 300 Mcg-60 Mcg-600 Mcg-300 mcg tablet, make sure to inform your doctor or pharmacist about any allergies you may have to its ingredients or to soy/peanut. It's important to discuss your medical history with your doctor or pharmacist, especially if you have a history of alcohol use/abuse, liver problems, or stomach/intestinal problems. If your multivitamin contains folic acid, be sure to inform your healthcare provider if you have a vitamin B12 deficiency before taking it. It's important to discuss any upcoming surgery with your doctor or dentist, and to inform them about all the products you are using. If you are pregnant or breastfeeding, consult your doctor before using this medication. It's important to be aware that this medication may interact with other drugs, which could affect how your medications work or increase your risk for serious side effects. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. If your multivitamin contains iron, it's best to avoid taking this product at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or some antibiotics. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. Additionally, this medication may interfere with certain lab tests, potentially causing false test results. It's important to make sure that lab personnel and all your doctors are aware that you use this drug. If you or someone else has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911. Otherwise, contact a poison control center as soon as possible. In the US, you can reach your local poison control center at 1-800-222-1222. For Canadian residents, you can call a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. It's important to seek medical attention if you suspect an overdose. Remember to keep all of your medical and lab appointments. Some brands of this medication may also contain additional ingredients like docusate, so if you have any questions about what's in your brand, be sure to ask your doctor or pharmacist. It's important to note that this product is not a replacement for a healthy diet. It's always best to get your vitamins from nutritious foods. Make sure to maintain a well-balanced diet and follow any dietary guidelines given to you by your doctor. If you are taking this medication on a prescribed schedule and you happen to miss a dose, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Remember to store this medication at room temperature, away from light and moisture. It's important to keep it out of the bathroom and out of reach of children and pets. Make sure not to flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. When the medication is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.